For more on the Democrats' next move on health care, let me bring in Congressman Joe Courtney of Connecticut. There are a number of, I would say, conservative Democrats who are concerned about this, but also liberal Democrats in the House who are concerned about just the pushing through of the legislation. Joe, thanks for joining us tonight. How much of a problem would it be, in your opinion?
Well, as you and I have discussed many times over the last few weeks, there are real issues with the Senate bill. The excise tax, which was the primary financing mechanism of the Senate, is something that finally was getting some positive attention, partly because of your show, because of the negative impact it would have on a lot of working families and middle-class families. The Senate bill does not go far enough to close the donut hole. The purchasing exchange in the House bill, which would be a national purchasing exchange and allow, I think, much greater pooling and better opportunity for affordable health insurance, is at odds with the Senate. So there's a lot of issues there that separate the two. That
But Congressman, the gist of all of this is that the president, his agenda for 2010 could be at stake.
Yep.
I mean, he could come over to you guys again and say, "Look, I got to have this. Are you willing to give it up?"
Well, there's a couple of ways that this could be approached. I mean, one of them would be to use the budget reconciliation process, the 51 vote rule, for a cleanup, if as a sort of a follow-up to a passage of the Senate bill. To be honest with you, that's going to be a very hard sell for everybody, and it's not just a progressive caucus issue. It really would require a lot of trust to say that there would be a follow-on to incorporate some of these changes. We don't want to even think about that. Your audience in Massachusetts should just keep pounding the phones. We got to make this thing work.
Well, basically, Congressman, what you're saying to the folks of Massachusetts tonight is they got to deliver the mail, and if they don't do it, health care reform in this country is in serious jeopardy, and so is President Obama's agenda.
No,
correct?
there's the stakes are huge, and you stated it perfectly. And the best way to make sure that we get a fair and balanced, to use a terrible phrase, compromise between the House and Senate bill is to make sure that we have 60 votes in the Senate and we have a Democrat from Massachusetts.
Well, here's how it's going to shake down. If Brown wins the Senate race and the President of the United States is sitting there in the balance, the Democrats in the House are going to have to take a very politically courageous position and stand up and say, Mr. President, we're with you. We're going to get something, whether it be just a pre-existing condition and 30 million people who are going to get covered. Wouldn't that be enough? Wouldn't in the totality of it all? And I guess I'm going to ask the provocative question, do you think the conservatives would have done this to George W. Bush? Tom DeLay would have twisted a lot of arms on his side to make sure that nobody screws this thing up. I mean, because of the situation in Massachusetts right now, it seems to me that it's very clear the Democrats are put in the corner in an untenable position to say, hey, we got to take what we can get on this deal. We didn't know that it was going to screw up like this in Massachusetts. What about all that?
Well, again, there's obviously going to have to be consideration of a plan B after tomorrow if it goes the wrong way. I've been involved in public life for over 20 years. Healthcare access and quality have been my passion. I mean, it's why what really made me run for office. So, the end game here, the big picture end game, which you described very powerfully, Ed, is really something that many of us don't want to let slip through our fingers for another generation, which is what we saw happen when Clinton Care collapsed. But again, Plan A is still to try and hold on to that seat in Massachusetts, and Plan B is to try and figure out whether there's either an expedited process to reconcile the two bills with the good changes that have really gotten a lot of momentum over the last week or so, or whether or not there is, again, a follow-on reconciliation process that can, again, incorporate the intelligent discussions that have been happening over the last 2 weeks.
Congressman, great to have you on. Way to fight for the people.
Thanks, Ed.